Hello, thank you very much for giving us an opportunity to speak today. My name's Esther, I'm a paediatrician. We've got Raj, who's a consultant rheumatologist, Jane, who's head of business development, and Gina, who's head of therapies. And we're here today to tell you a story about an illness that I feel very passionate about, but also give you a solution. And this is a solution that has not been talked about yet. Although I think when you hear it, you'll realise it's quite an obvious solution to many of the problems that you currently face. So the illness that I'm passionate about is chronic fatigue syndrome, or ME. This illness is a disaster for teenagers. Most of the teenagers that come to my clinic are attending 2 days or less a week of school. They've often been ill for 2 years. Their parents stop working, and about 30% of the teenagers I see have comorbid mental health issues, anxiety or depression. There is some good news. There's good evidence base for this illness. So if you access specialist therapies, you've got a 65% chance of full recovery within 6 months. If you don't, your chance of recovery is 6%. And the really bad news for these children is that only 15% of children across the UK have access to specialist care that's local. So our solution to try and drive down costs of secondary and tertiary care and also reduce inequalities is a solution that we've implemented locally and started to implement nationally, but we need help for. Looking at Sam. So our solution is that we employ local therapists embedded in local teams, in CAMS and physio and occupational therapy departments, to treat children, and we train them with specialty skills. They're part of our team, they attend our team meetings, they get specialty training, and they are specialists within a local service. Now, this has lots of advantages. The advantages for the patients. So the patients are seen locally, they're nearby, the therapists go to the same schools often as their children go to, they are embedded in local teams, but they have specialist skills. Has a lot of advantages for the therapists. Therapists improves recruitment and retention, we found. The therapists are engaged in a specialty area, they're trained to deliver special therapy, and it has advantages for local healthcare providers. We've noted reduction in secondary and tertiary healthcare costs. We see parents returning to work, and it has advantages for social care. What have we done so far? Well, we've implemented this throughout Wiltshire, Gloucester and Somerset, and we've also got a satellite model in Macclesfield. What do we want from Vanguard status? We'd like to roll this out for paediatric chronic fatigue syndrome across the UK, but we also think that this is relevant for long-term conditions where treatment is provided by therapists, and there's a range of conditions that you can think of in paediatrics. It's also important for a range of adult conditions, and without running into a sticky wicket or having a googly, I'm going to pass over to my adult colleague.
Gosh, I feel quite bowled over. As Esther said, my name's Raj. I'm an adult rheumatologist, and adults with musculoskeletal conditions face the same issues as children. Many of my patients say to me they travel a long way for what is relatively short outpatient appointment. And these patients need to be seen quickly. So what we've said is that the rheumatologists and the registrars who are seeing these patients are probably not the right people to see them. They would be better served by seeing therapists in the community. The Royal National Hospital for Rheumatic Diseases has a national and international reputation for treating patients with musculoskeletal diseases. I'd like to take fibromyalgia as an example. So the prevalence of fibromyalgia in the UK is around 3 to 5%. For Bath, that means 500 new patients and 400 follow-up patients every year. These are the patients we want seen by the specialist therapists in the community. Also in Bath, we run rehabilitation programs for patients with ankylosing spondylitis and fibromyalgia syndrome. These 2 and 4 week programs really improve patients' lives, and we're unique in the UK. We want to again develop and distribute and deliver these courses all around the UK. So if we're successful with the bid, what we'd like to do in the first instance is to open 2 or 3 satellite centres within the southwest of the UK. We'd get our specialist therapists to see the patients with fibromyalgia and deliver the care closer to home. Once at the same time, we would train up further specialist therapists. Once we had the model that was sustainable, reproducible and codified, we would then take it nationally. We also believe that this model could be used in other conditions, musculoskeletal conditions like osteoarthritis, and non-musculoskeletal conditions like irritable bowel syndrome. One of the really key things I'm passionate about is the use of technology in this bid. So in Bath, over the last 5 years, we've been developing a program on the N3 NHS Secure Network, which allows patients to fill in their outcome measures from home. This will then allow our therapists, when we've developed the model for fibromyalgia, to really provide the right treatment for the right patient at the right time. It will stratify the patients rather than build up a backlog that we want to avoid. Jane.
So hopefully what you've heard is that our model isn't just about a franchise solution for rheumatological conditions, but also developing a broader understanding of how franchising can help support other patients with long-term conditions. We believe that with our experience, we are really well placed to further develop and enhance the evidence base and protocols for treating patients with long-term conditions and help you as providers decide how you can franchise your specialised services safely and cost-effectively. We really want support from the Vanguard programme to help us address the really thorny issues we face around commissioning, governance and legal problems. But more importantly, we want to help develop a process for systematising and standardising patient and stakeholder engagement in the further development of franchise solutions. We believe that through this approach, we will build a franchise model of healthcare for which the NHS can become internationally renowned. Thank you.
I have questions from the team from the Royal National Hospital for Rheumatic Diseases, please. Right at the back, number 22.
Hello, Phil Corrigan from Leeds West CCG. Could you just tell me a little bit how this impacts on the financial sustainability of the system?
Yeah, so there's quite a lot of I'm actually really a researcher most of the time. There's quite a lot of research evidence on these particular group of conditions. So before patients access therapies, they're seeing lots and lots of consultant times, often across lots of different specialties. So children will see neurologist, pediatrician, cardiologist, and so on. And so, but once they access therapy in terms of CBT or whatever approach we're using for my condition, and it's the same for the others, what happens is that those consultations stop. So you reduce secondary and tertiary care level healthcare costs whilst actually trying to get the patient better.
So have the costs actually been modelled?
I think probably that's something we probably ought to, what we want to explore as part of the Vanguard programme. Locally, we know we've got a proven evidence base for it to work, but clearly part of this approach is around scaling up what we do locally in Bath and around the local centres we serve. And that's what we're passionate about doing, is bringing this out to the wider healthcare community.
Table number 15, please.
Yeah. Gordon Cairns from Cheshire. Could I ask, when you take on all these therapists, what happens to the doctors and nurses that have been treating these patients beforehand?
So thanks for the question. For us in Bath, we have over 2,000 follow-ups for patients who still can't be seen. So you know, there's a lot of work to do out there, and we just don't have enough staff. This, for me, is making sure you get the right clinician seeing the right patient, and not just saying, you know, you're a rheumatologist, you can see it all. We are being clever at who sees the right patient.
Question on number 19, please.
Hello there, yeah, Gilbert Wheeler, patient advisor for Wiltshire, Hampshire, Dorset. Two things. I haven't seen this rolled out over Wiltshire yet. You said it was being rolled out, so I need to look at that and check with that. More importantly, are you looking for advice with this, or are you looking for the financial support for the programme to run?
So we have 10 clinics in Wiltshire. And
have
I'd be
10
very
minutes.
happy to talk to you about that. We are desperate for advice, support. We've already actually got quite a lot whilst being here, which has been great. As Jane said, there are really difficult problems that we struggle with. There are really interesting, difficult challenges over how you contract out. There are difficult employment issues, difficult commissioning issues. We believe very strongly in this model, but we're looking for help, support, advice, and some funding would be great too.
And question on table number 9, please.
Thank you. Great to see a model about therapy in the community. I thought that was fantastic. I guess one of the things that therapists generally benefit from is coming to the centre, the education, the networking with colleagues, and it can be quite a lonely place in the community. So how will you do that?
Yes,
or
and
how
I
do
think,
you do it?
well, I think that's something that we've really noticed, and it's taken me a couple of years to get my head around it. So what we do is we have they come twice a year for team meetings. They go to national events, which we pay for, and then we have monthly or twice a month supervisions with them, and we use video conferencing for that. We also have a whole system for email contact. The really tricky issue is also how they deal with the very complicated patients. So we're actually asking them to deal with the straightforward patients on the whole, and they still need help and support with the more complicated ones, and that involves a process of upskilling them. There's CPD days. So it's a whole range. It's not one solution, it's a range of solutions you have to do.
Thank you. Any further questions? We have a couple of minutes. No further questions. Okay, so can I have a big thank you from the team from the Royal National Hospital?